There is something almost paradoxical about the advice that most people over 50 receive about hydration. Drink more water. Stay hydrated. 8 glasses a day. It is advice that is simultaneously correct and incomplete in a way that leaves out exactly the information that would make it most useful for an aging body. Because the problem for most people over 50 is not simply that they are not drinking enough water, though that is often true, and the thirst mechanism that should prompt drinking becomes measurably less sensitive with age, meaning older adults genuinely do not feel thirst as reliably as younger people do, and regularly move through their days in a state of mild chronic dehydration without realizing it. The deeper problem is that plain water, consumed without any additional consideration for what the aging cardiovascular and circulatory system actually needs, is doing a fraction of the hydration and blood flow work that the same volume of fluid could be doing with a simple, inexpensive, one-ingredient modification. And blood flow, the movement of oxygenated, nutrient-rich blood through the arteries, capillaries, and veins that supply every tissue in the body, is arguably the single most important physiological variable determining how well a person over 50 actually feels and functions on a daily basis. The energy levels, the cognitive clarity, the joint comfort, the skin health, the sexual function, the cardiovascular resilience, the speed of recovery from illness or physical effort, all of it depends on how effectively blood is moving through the body's vascular network. Understanding what happens to that network after 50, why plain water alone is insufficient to support it optimally, and what one specific addition changes the equation dramatically is the conversation that most senior health discussions are not fully having. After 50, the vascular system undergoes a collection of changes that compound on each other in ways that progressively impair blood flow efficiency. The arterial walls, which in a young, healthy person are elastic and responsive, expanding with each heartbeat and recoiling to help propel blood forward, progressively stiffen. This arterial stiffness is driven by a combination of factors, including the gradual replacement of elastin fibers in the arterial wall with stiffer collagen, the cross-linking of those collagen fibers by a process called glycation that is accelerated by chronically elevated blood sugar, and the accumulation of calcium deposits in the arterial media. The practical consequence of arterial stiffness is that the heart has to work harder to push blood through a less compliant vascular system. Systolic blood pressure tends to rise, and the pulse wave that should travel smoothly through the arterial tree arrives at the peripheral vessels with greater force and less efficient energy transfer. At the same time, the endothelium, the single-cell thick lining of every blood vessel in the body, undergoes functional changes with age. The endothelium is not passive plumbing. It is a dynamic, metabolically active tissue that regulates vascular tone, prevents clotting, modulates inflammation, and controls the movement of substances between the blood and the surrounding tissues. It does all of this largely through its production of nitric oxide, a small gaseous signaling molecule that causes smooth muscle in the vessel wall to relax, dilating the vessel and improving blood flow. Endothelial nitric oxide production declines significantly with age, reducing the vascular system's ability to vasodilate in response to the demands of exercise, temperature change, or increased organ activity. The capillary networks, the finest branches of the vascular tree, where the actual exchange of oxygen, nutrients, and waste products between blood and tissue occurs, also become less dense and less functional with age, reducing the efficiency of tissue perfusion even when larger vessel blood flow is adequate. This convergence of arterial stiffness, endothelial dysfunction, and capillary rarefaction is what underlies the poor circulation that so many people over 50 experience as cold hands and feet, exercise intolerance, slow wound healing, cognitive fog, and the general feeling of reduced vitality that conventional medicine tends to attribute simply to aging. Chronic mild dehydration makes every one of these problems worse, and this is the starting point for understanding why how you hydrate matters more after 50 than at any earlier period of life. Blood is approximately 55% plasma by volume, and plasma is approximately 90% water. When the body is even mildly dehydrated, losing as little as 1 to 2% of body water, an amount that produces no sensation of thirst in many older adults, plasma volume decreases, blood viscosity increases, and the heart has to work harder to circulate thicker blood through an already stiffened arterial system. Red blood cells, which are what actually carry oxygen to the tissues, move more sluggishly through thicker blood and through smaller capillaries, where flow is already compromised by age-related changes. The endothelium, deprived of adequate flow-mediated stimulation, produces less nitric oxide. Tissues that were already receiving suboptimal perfusion receive even less. The cognitive fog deepens, the fatigue is heavier, the joints ache more. All of this from a hydration deficit so small that the person experiencing it may genuinely feel that they are not particularly thirsty and would not describe themselves as dehydrated. The insidious nature of age-related dehydration is precisely that it does not feel dramatic. It feels like aging, because the symptoms overlap so completely with what aging is supposed to feel like that neither the person experiencing it nor sometimes their physician thinks to interrogate hydration as a primary contributing factor. Plain water addresses this dehydration problem incompletely, and understanding why requires knowing something about how the body actually absorbs and retains water. When you drink plain water, it moves from the stomach into the small intestine, where it is absorbed into the bloodstream through osmosis, the passive movement of water across a membrane from a region of lower solute concentration to higher solute concentration. The blood plasma has a certain concentration of dissolved substances, electrolytes, proteins, glucose, and water moves from the intestine into the blood in response to that concentration gradient. The problem is that plain water, having no dissolved solutes, creates a situation where the intestinal fluid rapidly becomes more dilute than the blood plasma on the other side of the intestinal wall, driving water absorption, but also simultaneously diluting the blood plasma itself, which signals the kidneys to excrete the excess water as urine before it fully distributes to the tissues. This is why drinking large amounts of plain water can produce frequent urination without fully correcting cellular hydration. The body is essentially expelling the water faster than it can use it. The body's ability to retain ingested water and distribute it to the tissues is dramatically improved when the water contains dissolved electrolytes, sodium, potassium, magnesium, in concentrations that match more closely the osmolarity of the blood plasma, reducing the osmotic gradient that drives rapid renal excretion and improving the efficiency with which ingested fluid actually reaches and hydrates the cells. This is not a theoretical principle. It is well-established physiology that has been understood in sports medicine for decades and that has clear and direct application to the hydration needs of older adults whose circulation is already compromised. The one trick that transforms plain water into a genuinely powerful circulatory support tool for people over 50 is the addition of a small, precise amount of high-quality mineral salt. Specifically, a natural, unrefined salt that contains not just sodium chloride, but the full spectrum of trace minerals present in its natural source. Pink Himalayan salt, Celtic sea salt, or Redmond real salt are the most commonly available options, each containing varying concentrations of magnesium, potassium, calcium, silica, and dozens of trace minerals alongside sodium. Adding approximately 1/4 of a teaspoon of such a salt to a large glass of water in the morning, and potentially smaller amounts to subsequent glasses throughout the day, creates what is essentially a gentle, whole food electrolyte solution that the body can absorb and utilize far more efficiently than plain water. The sodium content of this small amount is approximately 500 to 600 milligrams, well within safe daily intake for most people without medically diagnosed sodium-sensitive hypertension who have been specifically instructed to severely restrict sodium. For the large majority of older adults, this amount of sodium is not a cardiovascular risk, and there's a critical distinction to be made here between the refined, processed sodium found in packaged foods, which is associated with hypertension and cardiovascular disease through mechanisms related to the inflammatory and nutritionally depleted nature of that sodium source, and the balanced mineral sodium from natural, unrefined salt, which the body handles differently because it arrives in the context of cofactor minerals that modulate its physiological effects. The blood flow benefits of this simple electrolyte water begin with plasma volume expansion. Sodium is the primary osmotic driver of plasma volume. It is what holds water in the vascular compartment rather than allowing it to redistribute to tissues or be excreted. When electrolyte water is consumed, particularly first thing in the morning after an 8-hour overnight fast, during which the body has been losing water through respiration and perspiration without any replacement, the sodium and accompanying minerals support the absorption and retention of the water in the plasma, expanding plasma volume in a way that plain water does not achieve as effectively. Expanded plasma volume means the heart can maintain cardiac output with less effort. Blood viscosity decreases. Red blood cells move more freely. Tissue perfusion improves. All of this happens within 30 to 60 minutes of consuming the morning electrolyte water, producing effects that most people over 50 can actually feel. A noticeable increase in energy and mental clarity that is distinct from the alertness produced by caffeine, and that reflects genuine improvement in tissue oxygenation rather than nervous system stimulation. The magnesium component of unrefined mineral salt deserves particular attention in this context because magnesium is a mineral of extraordinary physiological importance that is simultaneously one of the most prevalent deficiencies in older adults. Magnesium is a cofactor in over 300 enzymatic reactions in the body, and among its most important functions is its role in vascular smooth muscle relaxation. Vascular smooth muscle, the muscle tissue wrapped around arteries and arterioles, determines vascular tone, which is the degree of constriction or dilation of blood vessels at any given moment. Adequate magnesium is required for this muscle to relax appropriately, allowing vessels to dilate and blood flow to increase. Magnesium deficiency produces a state of increased vascular tone, arteries and arterioles that are chronically more constricted than they should be, raising blood pressure and reducing tissue perfusion. Magnesium also works synergistically with nitric oxide in promoting vasodilation. It both supports endothelial nitric oxide synthesis and enhances the sensitivity of vascular smooth muscle to nitric oxide's relaxing signals. In an aging vascular system where nitric oxide production is already declining, maintaining adequate magnesium status is critically important for preserving whatever vasodilatory capacity remains. Studies consistently find magnesium deficiency in a large proportion of older adults. Surveys suggest that the majority of adults over 50 do not meet the recommended daily intake through diet alone, largely because magnesium is found primarily in whole grains, leafy greens, and legumes that are underconsumed in typical Western dietary patterns, and because age-related reductions in intestinal magnesium absorption further compromise status even when dietary intake is adequate. The small amount of magnesium contributed by mineral salt in electrolyte water is not sufficient to correct a significant deficiency on its own, but it contributes meaningfully to daily intake as one component of a broader strategy. Potassium is the third major electrolyte in this picture, and its relationship to blood flow and cardiovascular health in older adults is both well-established and chronically underappreciated in public health communication. Potassium is the primary intracellular cation. It is concentrated inside cells and is essential for maintaining the electrical gradients across cell membranes that allow nerve conduction, muscle contraction, and the rhythmic electrical activity of the heart. In the cardiovascular system specifically, potassium acts as a natural counterbalance to sodium's blood pressure-raising effects. Adequate potassium intake promotes renal sodium excretion, reduces vascular resistance, and produces direct vasodilatory effects through its influence on endothelial cell function. The epidemiological evidence linking higher dietary potassium intake to lower rates of hypertension, stroke, and cardiovascular mortality is among the most consistent in nutritional epidemiology. Most older adults are significantly below the recommended daily potassium intake, and the reason is straightforward. Potassium is concentrated in fresh fruits, vegetables, and legumes, and the average dietary pattern in the over 50 population does not include adequate quantities of these foods. While mineral salt does not provide large amounts of potassium, adding it to water consumed alongside a potassium-rich morning routine, a banana, some avocado, a glass of coconut water, creates a cumulative electrolyte environment that more closely matches what the aging cardiovascular system needs. Beyond the electrolyte mechanism, there are complementary additions to water that amplify its blood flow benefits further and that are supported by specific mechanisms worth understanding. The most evidence-backed of these is a small squeeze of fresh lemon juice, enough to add genuine tartness without making the drink unpleasant, typically half a lemon in a large glass. Lemon juice contributes vitamin C, which is a direct cofactor in the synthesis of collagen, the structural protein that makes up the connective tissue matrix of the arterial wall, and that is required for maintaining the structural integrity and elasticity of blood vessels. Vitamin C also regenerates oxidized vitamin E, the primary fat-soluble antioxidant in cell membranes, including the endothelial cell membranes lining blood vessels. And it directly quenches superoxide, the free radical that destroys nitric oxide before it can act on vascular smooth muscle. The endothelium is under constant oxidative attack from the metabolic processes of the cells around it, and vitamin C is one of its primary defenses against that attack. Beyond vitamin C, lemon juice contains flavonoids, including hesperidin and iriocitrin, that have been shown in clinical studies to improve endothelial function, reduce arterial stiffness, and improve measures of microcirculation, the blood flow in the smallest vessels where tissue oxygenation actually occurs. A study examining hesperidin supplementation in older adults found significant improvements in microvascular reactivity, the ability of small vessels to dilate in response to increased demand, suggesting that the flavonoids from citrus consumed regularly can meaningfully improve the functional impairment in microcirculation that characterizes aging. A pinch of cayenne pepper added to this morning drink represents another addition that sounds unusual but has genuinely compelling mechanistic support for blood flow enhancement. Cayenne contains capsaicin, the compound responsible for its heat, which activates receptors called TRPV1 channels in the endothelium and in sensory nerve fibers around blood vessels, triggering the release of substance P and calcitonin gene-related peptide, both of which are potent vasodilators. The vasodilatory effect of capsaicin is rapid and occurs in peripheral vessels, including those in the hands, feet, and skin, precisely the territories where circulation is most compromised in older adults with poor peripheral circulation. Capsaicin also stimulates the production of nitric oxide in endothelial cells through pathways independent of the shear stress mechanism, providing an additional stimulus for vasodilation in a vascular system where flow-mediated dilation is declining. Regular consumption of cayenne has been associated in epidemiological studies with significantly lower rates of cardiovascular mortality, findings consistent with the mechanistic evidence for its vascular effects. The amount required in the morning drink to produce these effects is small enough that most people can incorporate it without finding the drink unpleasantly spicy. A pinch, about 1/16 of a teaspoon, in a large glass of water alongside the salt and lemon produces a flavor profile that is warming and slightly tart rather than aggressively hot. The timing of this morning drink, consumed before coffee, before food, and within the first 30 minutes of waking, is as important as its composition. During sleep, the body loses fluid continuously through respiration and perspiration without any replacement, and by the time a person wakes after 7 to 8 hours, they are already in a mild state of dehydration that has contributed to the overnight concentration of the blood. Blood viscosity is at its daily peak in the early morning hours, which is one of the reasons that cardiovascular events, including heart attacks and strokes, occur at their highest frequency in the morning. The combination of elevated blood viscosity, circadian increases in platelet aggregation, and the morning surge in blood pressure and heart rate creates a cardiovascular stress window that proper morning hydration directly addresses. Consuming the electrolyte drink before coffee is particularly important because caffeine is a mild diuretic that increases renal water excretion and can compound the morning dehydration state if consumed before baseline hydration is restored. Getting the electrolyte water in first, rehydrating the plasma, reducing blood viscosity, providing the mineral substrate for endothelial nitric oxide production, and delivering the vasodilatory compounds in the lemon and cayenne before the stimulant effects of coffee take hold, creates a morning vascular environment that is meaningfully better than the reverse sequence. The cumulative effect of this daily practice across weeks and months is where the real significance lies. Blood flow is not improved by a single intervention on a single morning. It is improved by consistent daily support of the biological processes that maintain vascular health, delivered reliably over time in a way that the body can integrate and build upon. The endothelium responds to consistent nutritional support by producing more nitric oxide, reducing inflammatory signaling, and improving its regulatory function. The vascular smooth muscle, consistently provided with adequate magnesium, maintains a lower baseline tone and a more responsive vasodilatory capacity. Plasma volume, consistently maintained at its optimal level by daily electrolyte intake, supports cardiac output without the compensatory heart rate elevation that chronic dehydration produces. These are not dramatic overnight transformations. They are the kind of steady, cumulative improvements in vascular biology that produce the gradual, sustained increase in energy, clarity, warmth in the extremities, exercise tolerance, and general vitality that people describe when they have been consistent with this practice for long enough to feel its effects compound. What makes this particularly compelling from a practical standpoint is that it costs almost nothing, requires no prescription, involves no complex protocol, and can be fully established as a habit within a week of beginning. A bag of quality mineral salt costs a few dollars and lasts months. A lemon costs pennies per day. A jar of cayenne has been sitting in most people's spice cabinets already. The glass of water is already there. The entire modification to an existing hydration habit takes 30 seconds of preparation and produces a drink that tastes pleasant, slightly mineral, slightly tart, gently warming, in a way that makes it easy to look forward to rather than something requiring willpower to consume. For people over 50 navigating a healthcare system that is far better at treating disease than preventing it, at prescribing medications than optimizing nutrition, at addressing symptoms than improving the underlying biological function that determines quality of life, finding something this simple, this affordable, and this physiologically rational feels important. Not because it replaces medical care, not because it cures anything, but because it addresses a real and specific biological need of the aging cardiovascular system in a way that plain water simply does not. Your body after 50 needs more from its hydration than water alone can provide. The minerals, the vitamin C, the capsaicin, the flavonoids, they are not extras or enhancements added to a complete foundation. They are part of what a complete foundation actually looks like for a vascular system that has been working for 50 or 60 or 70 years and that deserves the most intelligent nutritional support you can give it every single morning.